Hello, I'm Dr. Ben Newman, and I am a coronavirus researcher. So yeah, let's try and answer some of your questions. I think we got two more questions today. So the first one is going to be from Amy, and how are you doing, Amy? Yeah. Let's see. Hi, Dr. Ben. Hi, Amy. Um, you wouldn't believe how many people I've spoken with that think that once they've gotten the vaccine, it's safe to be with others in close proximity. Yeah, that's not how it works. And no, I would not be surprised. I don't personally have Facebook or Instagram or anything, but yeah, members of my family do, and yeah, uh, they show me the things and they tell me the things. Yeah, people, man, people. uh, yeah. Anyway, let's finish your question. Yeah, before I get too hung up on that. Let's see. I have understood that you could still be a carrier, potentially. And so until those people get their vaccine, you could bring them the virus, even though you've had the vaccine. Yep. Is this right? Yeah. So the vaccine works at best in about 90% of people. That's like the best vaccine on the best day. And within the 2 months after you've had the vaccine, like right after, like this is best case scenario, about 90%, which means that 10% ish chance, or 10% of people that get the full vaccine can still get infected with the virus. And so if they do dumb stuff, which is what we can categorize all the things you're talking about, yeah, just like hanging out together and whatever, then yeah, they can pass it. And I think it's easy for the human brain to say, well, there's only a 10% chance, and I know I'm in the 90%. Yeah, I'm above average. Yeah. And honestly, nothing works that way. Yeah, that's just, except our brains. Our brains may work that way. And yeah, that is not necessarily a survival advantage, I would say, to anybody. Um, so yeah, about a 10% chance that a person could, yeah, pick up the virus and spread the virus. And particularly, I would say if you've got people that are going out and they've had this sort of pent up, I want to do dumb stuff, get really close, somebody else's face and just hang out there, wow, and smell their coffee breath or whatever. If you've got somebody that's had that bottled up and is just releasing it all now that they've got a vaccine, they may be more likely to actually pick up the virus. And yeah, at that point, it's going to depend. Are they one of the people who is able to control and stop the virus, or are they going to be one of the people that actually ends up catching the virus and spreading the virus? And hanging out with somebody who says, oh, I got the vaccine, it's totally cool. It's not cool because they don't know if their immune system has done what it needs to do and whether they are actually protected. That's the main thing there. I'm not necessarily concerned as much about a person who has a good immune response and is able to fight off the virus, still getting low grade virus infection and passing it on. I think that's something that possibly could happen, but it's not something where I have seen papers yet, so that would just be speculative at this point. And we know that vaccination does dramatically decrease the amount of all the symptomatic disease. And so I think the sort of basic assumption would be that probably we're also decreasing the amount of asymptomatic disease by at least the same proportion. Yeah, that would be my starting hypothesis. But like you, like anybody, any thinking person, we shouldn't just make a hypothesis and then call it a day and go home. We should make a hypothesis, test the hypothesis rigorously several times, and then based on the results of that, then we can decide whether or not it was, yeah, a good idea or not a good idea. And so for now, I like where you seem to be coming from, which is that just because you have the vaccine doesn't mean anything. When we get to a point where basically everybody's had the vaccine, not just everybody in your book club or friend group or whatever, drinking buddies, but like everybody, then you'll find that the number of actual cases of the virus is going to go way down, And this is how we can drive the virus to extinction. And when we've got a situation where there is literally no virus around, like has been the case in New Zealand, yeah, on and off for a while, Australia on and off for a while, Iceland on and off for a while. When we're in that situation, we'll still have to do a bit of surveillance, like saliva testing or something. But yeah, at that point, I think then we can start to finally relax. We just got to not mess it up between now and then. This is like the critical period. We're getting there. We're finally getting somewhere. And yeah, just got to be cool. Be cool. Yeah, don't mess up. And then we can actually get through this and not just run face first into another wave of virus, which is not what anybody wants. The longer this thing is out there, the more chance it evolves into something that is distant enough from the vaccine that you don't get as much protection. And at that point, we got to go back and vaccinate everybody again with a new version. And at some point, we got to vaccinate the entire world within about a 6-month window with a version of the vaccine that works against whatever the main versions are that are circulating in order to get this thing basically stamped out. So that's the goal. It's a big goal. It's a doable goal. Humans have done stuff like this before, yeah. But it's not a thing that's going to happen immediately, and it's not a thing that's going to be helped by, yeah, your friends or whoever hanging out and, partying like it's 1999 and we don't even know what SARS coronavirus 1 is yet. Anyway, thanks very much. Very good question. Very thought-provoking. And this has been Ask Dr. Ben.